Hello. Hello, everyone. Our topic for today is trust in the healthcare system. Very important topic here in Israel and I think around the world. I'm Bruce Rosen for Israel Healthcare Highlights, and my special guest today is Dr. Adi Niv-Yagoda, one of the most astute and most respected observers of Israeli healthcare. Welcome, Adi.
Hi, Bruce. Thank you, and thank you for having me here.
Our pleasure. Adi, please tell everybody a bit about your background and about your current activities.
Okay, so I'm more than 25 years in the health system in Israel. I'm expert in health policy, strategy, and medical law. I'm also vice dean and senior lecturer at School of Health System Management at Netanya Academic College. And I'm also teaching at the School of Medicine and the Faculty of Law in Tel Aviv University. In the last 20 years, I served on many public and governmental committees in the field of healthcare. And during the COVID time, I was a full member of the expert cabinet advisor that advised to the Israeli government. And when we are going to speak on trust, that was a main issue, and we will see it soon.
Well, that's terrific. So, what do you mean by trust and why is it important?
So first of all, we need to understand the trust. It's maybe the most powerful, effective, and important tool to manage systems, especially health systems. Because if we want to see how people act, the behavior, we can see that the trust is the most powerful tool that can manage not only in pandemic time, every day. And trust, we need to understand that we need to work on it. And we need to work on it all time. And I want to show you some slides that will show what is trust. And as you can see, trust is more than just a word. Trust is a mindness. It's a psychological state of mind, how we relate to people, institutional, and the process. And it's important to understand that trust is influenced by an emotional perceptions. So trust is not just a word. Actually, it's kind of relationships. It's a dynamic system. We need to work on it. We need to work on it all time. And once the trust is broken, it's very difficult to rebuild it. And we need to understand it because it's not like we do one act and then we stop. We need to work on it all time, every time. And this is maybe, as I said, the most powerful tool that we can work with to to um, to to guide people for a good health and for a good system.
Okay, so tell us a bit about how that plays out in practice in Israel and other countries. What can you tell us about this?
Okay, so the Israeli story is very unique because we are having a very unique system in Israel. You know, we have the HMOs. It's very unique institutional in health system in the world, but we have kind of paradox in Israel, and we need to see the paradox that we have here. And I want to show you some of the paradox that we are seeing in the Israeli system. On one hand, we can see that the Israeli population said that they trust the public healthcare system, and we can see it's fantastic, like fantastic percent. 79% of the population are saying their trust on the Israeli health system. But on the other hand, we can see the behavior of the public, and there is a big difference between what they said and how they act. And as you can see here on the slide, if we are just taking the private health insurance in Israel, we can see that more than twice in Israel, the people are buying private health insurance. It's more than twice than the OECD average, and it's a fantastic. And also, we can see that in the last years, the vaccination rates are dropping. People are going less and less to do vaccination. We can see that people want to choose their own doctors. They don't trust the system who choose the doctor for them, for example, surgeons, and they want to control it by choosing. And there is another another thing that bother us, because many people believe that only if you have a connection, you can get a good care. And this is the paradox between what the people saying that they trust, like almost 80% of the people. It's fantastic. I don't think that we have another system in Israel that so many people are trusting in it, but they're acting different. And this is the paradox between what we sell and what we act. And this is one of the things that we need to see when we're speaking about trust.
So what builds trust and what can destroy trust?
Perfect. So I will show you in a minute what will build trust, but I want to speak what is destroying trust, and to show you the COVID as a test case for that. So the big enemies of trust, it's a thing that we all know, and we saw it many times. For example, we can see that fake news is a big enemy. We can see that misinformation, disinformation, politicization of knowledge, all are those are the big enemies of trust, and we saw them on very powerful on the COVID time, at the pandemic. And we can see that even the horror scenarios that the government showed to the people, and they said, we will have many people who are going to die. And in the reality, the population saw that it's a little bit different, or not a little, it was a big difference between the scenarios and the reality. And those are the big enemies of trust, because when the people seeing that the government says something, one thing, and the reality is going to another way, and you put the political situation and the fake news, and you can see that the trust is getting bigger, it's growing. When it's broken, it's hard to fix it. And when it's grow, we can see, and this is maybe the most one of the things that we need to see, that the distrust, the behavior of medical employees, and how people acting not only on the population, also the nurses, the doctors, and we could see dropping in vaccination also in medical employers, in health employees.
Adi, we only have a minute left, so what's the last point you want to make for us?
So I want to show you first what is the enemies of the public trust, but I want to also to recommend how to build trust. And as you can see here, there is many methodological ways to build trust, and we should remember always that we need to work on it. We need to do it all day, every day. We need to know how we are speaking with the public, and the way that we messaging can make a big difference. We can the way that we are speaking with the public, with the population, it can build trust or destroy the trust. And one of the important things that we need to see
Mhm.
is to recognize the manipulations. We need to recognize all the methodological that destroy the trust, and to see how we can do it better, how we can do it that that we are building a trust, and that we need to work on it, as I said many times in this conversation, and we need to do it right. And the Israeli secret, I think we have like a Israeli secret for success, because we saw, all the world saw the success in Israel on the COVID time. I think that our secret is the professional workers in the health system. We have like a fantastic doctors, nurses, the people who work in the Israeli system. They are building the trust.
Adi, this has been really fascinating. I think we've all got a sense of not only the importance of the issue of trust, but that you're a kind of person that we can trust. And I'll tell everybody here that Adi is one of the most trusted people in Israeli healthcare. He's often asked to be on commissions, as he mentioned. He's often asked to speak at conferences. And it's been a great pleasure and honor to have you with us here today, Adi. Thank you.
Thank you.